Effaclar Duo Solution, (NON), is a product that contains benzoyl peroxide and is used to treat mild to moderate acne. It works by reducing acne-causing bacteria and causing the skin to dry and peel. Some people also use it to treat a skin condition called rosacea, which can cause pimples and bumps on the face. It's important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Always make sure you are using the right product for your needs to avoid any harm. The recommended daily dosage and optimal timing for using Effaclar Duo Solution, (NON), will depend on your specific skin condition and should be discussed with a healthcare professional. Before starting to use Effaclar Duo Solution, (NON), it's important to check if you are allergic to it. You can do this by applying a small amount to 1 or 2 small areas of acne for 3 days. If you have an allergic reaction, stop using the product and seek medical help. If there is no allergic reaction, then you can continue using the product. There are different forms of benzoyl peroxide products available, some of which may require a prescription. Consult your doctor or pharmacist to determine which product is best for you. If you are using the over-the-counter product, make sure to read and follow all directions on the product package. When using Effaclar Duo Solution, (NON), to treat acne or rosacea, apply it to the affected areas of the skin as directed. Be careful to avoid getting the medication into your eyes, nose, mouth, or on any areas of broken skin, as it may cause irritation. If this happens, flush the area with plenty of water. Cleansers containing benzoyl peroxide should be gently rubbed into the skin for 10 to 20 seconds, worked into a lather, and then rinsed thoroughly and pat dry. If excessive drying occurs, you may need to rinse the cleanser off sooner or use it less often. The dosage of Effaclar Duo Solution, (NON), is based on your medical condition and response to therapy. Improvement in acne or rosacea is usually seen after 3 to 4 weeks of use, with maximum benefit after 8 to 12 weeks of use. Do not increase your dose or use this medication more often or for longer than directed. If your condition does not improve or worsens, or if you think you may have a serious medical problem, seek medical help right away. During the initial treatment, you may experience skin reactions such as peeling, itching, irritation, and reddened skin. If these effects persist or worsen, consult your doctor or pharmacist. They may recommend using smaller amounts of the medication or applying it less frequently. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Serious allergic reactions to this drug are rare, but if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, consult your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before using Effaclar Duo Solution, (NON), it's important to talk to your doctor or pharmacist if you are allergic to benzoyl peroxide or if you have any other allergies. This product may contain inactive ingredients, such as perfumes, which can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that this medication may make you more sensitive to the sun, so it's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you get sunburned or have skin blisters/redness, it's important to notify your doctor right away. For pregnant women, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using it. It is also unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions when using Effaclar Duo Solution, (NON). This product may interact with dapsone used on the skin. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Also, be sure to consult your doctor before starting, stopping, or changing the dosage of any medications. If this product is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the US, you can call 911 or contact your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. It's important to take the appropriate steps if you or someone else has ingested this product. Make sure to keep up with your regular medical appointments and any necessary lab tests. This will help ensure that you are using Effaclar Duo Solution effectively and that it is providing the best results for your skin. If you happen to miss a dose of Effaclar Duo Solution simply use it as soon as you remember. If it's close to the time of your next dose, just skip the missed one and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. When it comes to storing Effaclar Duo Solution it's important to keep it at room temperature. Different brands may have different specific storage needs, so be sure to check the product package for instructions or ask your pharmacist for guidance. And of course, always keep medications out of reach of children and pets. When it comes to getting rid of any expired or unused medication, it's important to do so properly. Don't flush them down the toilet or pour them into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard the product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.